So the second presentation of the day will be moderated by Terry Allan. Terry is the Health Commissioner for Cuyahoga County, I love saying that word, Board of Health, and a member of the Roundtable on Population Health Improvement. Terry?
Thank you, Phyllis, and good morning. I have the pleasure now of introducing the CEO and President of CommonHealth Action, Natalie Burke, who I've got to know well. She has helped to shape our community health improvement plan and to help us to think meaningfully and to help us create a clear line of sight in building equity into our planning process across a range of partners that has had, I think, a profound impact on our work and how we're moving forward. And she's done that, and CommonHealth Action has done that with a number of communities. And so it's my pleasure to welcome Natalie Burke to the board.
Thanks, Terry. Thank you. Good morning.
Good morning.
That was pretty good. But you can do better. Good morning.
Good morning.
All right, thank you very much. I'm very happy to be here with you. I have been stewing about what to say to you today. It's really interesting sometimes when it's time for me to go and talk somewhere, it all just falls together very nice and it's a very neat thing. That wasn't the case with today. This is complex stuff, and it requires a degree of thought and introspection in order for us to see movement and change that actually manifests in improvements in population health. So a little bit about who we are and what we do. CommonHealth Action aligns people, strategies, and resources to generate solutions to health and policy challenges. And what does that mean? That means that we often work as an intermediary organization that sometimes people think of as building capacity, providing technical assistance, but I think part of what we do also is to create readiness for change. So one of the things that I do want to point out early in this, when you think about capacity building, we all want to jump to capacity building. Have you thought about readiness? Have you assessed readiness? Because here's the harsh reality of doing this type of work around equity, diversity, and inclusion. If you jump into capacity building and you don't understand readiness, you will be buying parts, building the plane, flying it, and deciding if it's a Learjet or a helicopter. And there's a really good chance that you will crash. So I encourage you, before you think about capacity building, ask yourself some fundamental questions about readiness. A lot of our work has to do with the 5 M's: to map, make, manage, measure, and master change. So change to what end or for what purpose? It's really about for the production of health. So when people bring us in to do work related to their change, they often don't realize that they're actually working to improve health. And we don't necessarily tell them, because that's okay. If we're using a determinants of health perspective, if we're looking at health as a production of society, that means that we have to work across sectors and across disciplines. And that means that we have to figure out not only how to make this appealing to people, but actually how to put it in a language that's relevant for them and meaningful to them. So part of what we do in this change thing that we do in the world around equity, diversity, and inclusion is that we have a curriculum. And we have been for years going around the country and training people about equity, diversity, and inclusion. And recently came to the decision, why are we not doing this here in Washington, D.C.? Why are we not just offering it here? Because generally, we're invited into organizations like Terry's to go in and train the entire workforce, spend a couple of days with them. And often what we'll do is to take the core curriculum and then tailor that to that place. So use data that are relevant to that place, use historical context that's relevant to that place. So the question that we had was, can we take this to the general public, open it up, and make it relevant to them without tailoring it? Is there a sweet spot in this conversation that appeals to people who don't do health for a living? The answer to that is yes. Society is generating and continues to generate a demand. Situations like the University of Missouri, like the protests going on at Yale, means that the phone is starting to ring from universities who are saying, we've got to deal with this from a number of different perspectives. So if we are thinking about equity, diversity, and inclusion as part of the roadmap to health equity, we've got to look at that through this lens of determinants of health as well. And that means we've got to look across sectors. So when we have the equity, diversity, and inclusion training, what do? We have 6 core competencies that we focus on. The first being common language, and I'm going to get into that a little bit more later. The other being about historical context. So it's remarkable that people really don't get that what you see in terms of infant mortality, crime rates, early death, often can be mapped back to redlining maps that were made back in the 50s. And that if you overlay those maps, you can see hotspots of where decisions were made to redline communities. And because of that, and the inability to accumulate wealth from generation to generation, the inability to pass that on, has led to and perpetuated these health inequities that we see. In addition to that, we focus on privilege and oppression. We do that from the standpoint of your individual experience and then your experience as part of groups to which you belong. Some of them you were born into. Some of them you may not even know you belong to. Others, people may assume that you belong to those groups. And some change throughout the course of your life. So an example that I would give you is, and some people, pause on this. In the United States, you're considered an elder when you are over the age of 40. That's when employment law, right, guilty, right. That's when employment law kicks in to protect you. So there are some people who would say, oh, this person will never experience oppression, but if you live long enough, you will. That's one way to look at it. Another competency that we look at developing through the EDI training is an equity lens. And it's this idea about how you look at the world. And I'm going to talk about that a little bit more. Obviously, policy, understanding the role of equity, diversity, and inclusion in policy. And the implementation of policy is also a really important part. And then a commitment to ongoing learning, which is a really interesting thing. If you don't incorporate this into equity, diversity, and inclusion training, it literally becomes a binder that sits on a shelf. So there has to be a commitment not only to act when you leave, but to continue to work when you're done. So one of the first things that we do is common language. And there's a really big reason for that. Probably about 15 years ago, I went in to speak to a group. And I asked them to take out a sheet of paper and asked everybody to write down their definition of health. There were 17 people in the room, and this was a coalition that had been working together for over 3 years and couldn't understand why they had not made progress. They wrote their definitions down, and I collected them. We had the conversation, and at the end of the meeting, we took them out and looked at them. There were 17 people, and there were 17 definitions. There was no common language or common understanding. Therefore, there was no ability to dream together, to envision things, to plan, to negotiate, or even to argue, because you're not even talking about the same stuff. So I'm going to start here. And what we found in doing this work, equity is such a little word, but people struggle with it. They want to default to equality. People, when they're talking about equity, will start using the word equality. It keeps kicking back in, and it's very hard for people to shake it loose, right? So we all know what equal is, we know what equality is, and we know, in theory, we know what equity is. But the ability to express that to audiences who aren't the usual suspects becomes increasingly important if we want to see change happen. So, part of the way that we do this is with some very simple analogies. And I'm sure many of you have seen this one with the track. For those who maybe haven't, the idea here is if you're running a 100-yard dash, it's a straight track. Everybody lines up shoulder to shoulder. So the start is even, it's equal, and there's no reason that you would want it to be any other way. But if you're running a 400, and do I have anybody in here who's run, you ran track, you run track? Okay, in the 400, you have a staggered start. Can you tell me why? Outside lane is longer, inside lane is shorter. So if you lined up shoulder to shoulder, there's an unfair advantage to the person who's on the inside lane, while the person on the outside lane is hoofing it. Doesn't matter how hard they trained, how hard they worked. It may not even really matter how fast they run, because the difference is that great, they can never catch up. So this is an example when you're trying to get people to understand what equity is. It's one that is a real world example that tends to resonate with people. Equity and equality. Now, how many of you are familiar, and there may be people in here who are so young that you don't know that Oprah Winfrey used to have a show that came on every afternoon. I had a reality check the other day with this because I had a couple of people looking at me like, really? Okay, so before the OWN network, there's this woman called Oprah Winfrey, and she used to have a show on every day for an hour. And once a year, she would have this show, and it was Oprah's Favorite Things. How many of you remember the Oprah Favorite Things show? I used to sit in my house and dream about being in Chicago for that show. The reason was because the people who were in the audience wouldn't know that it was the Favorite Things show. And the entire show was Oprah bringing out stuff, cars and coats and jewelry and computers, stuff that she had fallen in love with, and just because you were in the audience, guess what? You're gonna get it too. So today, let's imagine this is the Favorite Things show, and I'm Oprah. And this is supposed to be your reaction, okay? All right, now, guess what? Let's all imagine that if you were to look under your chair, you all are gonna get these fabulous men's size 12 cowboy boots. I know some of you have them, it's okay. Now, let me ask you the question. How many of you can use the boots? Who can wear a men's size 12? Only Colin, nobody else. Okay. The point in this being, you all have gotten the boots. Technically, the boots, they all cost the same amount, right? But your ability to use them, the value to you, is very different than it would be to Colin. Colin would feel like he got hooked up. I got cowboy boots, I'm great, right? So you have equality, but you don't have equity. Now, I'm sure many of you are familiar with this picture and the idea of the equity lens. One of the things I want to say about the equity lens is it's about more than understanding who experiences the benefits and the burdens of decisions and programs and policies and practices. I actually like to think of it as, have you ever heard people say they've seen something and then they can't unsee it? I believe that that's part of the equity lens. Once you've formed the equity lens, it becomes almost like an upsetting thing, and it can be a burden because you actually can't see the world the same way again. You don't want to see the world the same way again. So in addition to understanding who experiences the benefits and who experiences the burdens, if you really have an equity lens, you can't take it off. It stays with you, and that's a really important part of understanding the equity lens as a concept. So how do you get an equity lens? Well, in our work, we think about it as perspective transformation. And bless Mesereau, but this is incredibly dense, so I'm going to make it really, really simple. When you know, think, and believe something different, you will decide, act, and do differently. It's that simple. That is perspective transformation. So how do you get to perspective transformation? We look at it in two ways, the head and the heart. We've worked with a lot of organizations around the country who want to take one approach or the other, right? You do equity, you work on equity, you focus on equity because it's the right thing to do, okay? It's the fair thing and the just thing to do. And then you have the other folks, it's all in the head. It's about the facts and the data, and you can make a case for equity because you can show how, ... right? What we find is if you take one approach by itself, it doesn't work. So you have to approach this if you want people to begin to embrace equity. If you want people to particularly embrace equity, diversity, and inclusion, you have to be able to make your case in terms of the head and the heart. The other thing that I want to point out about this that I think is important, and this is in the heart category, human beings are hardwired for fairness. It's actually part of our survival mechanism. So when we live in cultures and in societies, when we exist within institutions and communities that are inherently inequitable and unfair, we live in a state of constant and perpetual dis-ease, okay? And how do we see that manifest itself? It's disease, right? It's part of why societies that have great inequities have great illness, disease, and early death. So this is an interesting thing because language is really important. Why not health equity? When we go around the country, we don't really talk about this as health equity, to be honest with you. You know, when we're with the choir, we talk about it in that way, but we don't talk about it that way with other people. You want to know why? If I walk into certain situations, certain organizations, certain agencies in front of certain leaders, and I talk about health equity, they'll say, oh, we don't do health. Health's not my thing. That's those people's thing. Isn't that what you do? It's not my problem. I don't need to be concerned with it. So why not equity? This is really simple. This is not about the value of your home. So when you just talk about it straight out as equity, I mean, you got to work past that too. So where have we landed? We've landed at equity, diversity, and inclusion, and it's a really interesting thing. If you'd said to me even 6 years ago that we would have ended up in this place of EDI, I would have said, no, not going to happen. But it's happened, and there's a really clear reason for this. In the United States in particular, for the past 20 years, there has been an incredible amount of investment in diversity and inclusion, right? So now, to go into organizations and to speak to entities about this thing that is equity and not acknowledge the investments in diversity and inclusion, it's not a good strategy. Businesses have bought into diversity. They recognize it saves them money, it makes them more competitive, it increases their value, their share of the market, et cetera, et cetera. Diversity and inclusion pays, and so now business is starting to recognize that equity, as the next step of diversity and inclusion, could actually make it pay more. So we look at diversity, and I think we all know what that is, and the way that we look at it is that inclusion is the muscle of diversity. Inclusion is diversity in action. So here's the thing, you can have diversity and inclusion, but not have equity. But you cannot have equity without diversity and inclusion. And so I think it's really important to recognize there is this triad, this thing between equity, amongst equity, diversity, and inclusion. And there's a reason why we're wrapping them together in a package. It makes it easier to create a path and to make a case for equity when you bring it together with diversity and inclusion. Now, the part about equity, to have people to understand that if you only talk about it as fairness, it's not enough. So part of what we do through the equity, diversity, and inclusion training and in the curriculum is to really focus on these ideas of privilege and oppression. And I think it's important to note, these are not value judgments or character assessments if people say that you are privileged or oppressed, okay? They talk about how you experience the world, often through no fault of your own, and how you interact with systems and institutions and how the world perceives you, right? So although you experience as an individual, it's not about you necessarily as an individual. So think about privilege and oppression like this. People who are privileged are on the up escalator for a lifetime. They don't necessarily have to take a step, they just have to get on the escalator and it carries them to the top. But people who are oppressed, they're trying to go up a down escalator. If they pause even for a moment, they end up back at the bottom. They have to work harder, faster. They have to be stronger. They can't take a misstep. Otherwise, they end up back at the bottom. So this is yet another example of how you can begin to frame equity in speaking to different audiences. Now, all of this happens within the context of power. So when you think about power, and it's so funny, defining reality, you know, the first time I actually saw this and I really thought about this, the first thing that came to mind was poor people. People who live in poverty do not have the luxury of defining their reality. It's one of the reasons why they experience chronic stress, right? So power is critically important, and how power plays out in our society as it relates to privilege and oppression and equity and diversity and inclusion, it's all incredibly important. How many of you all have seen this? Not many. I'm going to give you a second, and hopefully you all should be able to read it. The Atlantic slave trade between the 1500s and 1800s brought millions of workers from Africa to the southern United States to work on agricultural plantations. Okay? So slavery, it would seem, was a guest worker program, right? This was in a textbook in Texas, and a mom saw this who was helping her high school student with their homework. And I think she might have passed out when she read this. And so she went on Facebook and pasted it, and it started a huge conversation, and McGraw-Hill ended up having to put, it's interesting, they didn't pull the books, they put a sticker on the books, just to be clear. And the point here is, the folks in Texas, this was what they wanted in their textbook. And they had the power to create a reality, to create a perception for millions of high school students who are just learning about this, and that then becomes their context for how they view the world. Power is a really important thing. Now, remember the thing earlier, the little kids looking over the fence? This is another version of it, and I want you to take a second and look at it, and I want to ask what you see. What do you see when you look at this? That would be one part of it. Who's positioned where? Where's the girl? Okay? So when you see the normal image of this, of the three kids lined up and looking over the fence and they're standing on the things, it's a different concept. When you look at it like this, there are some things that are woven into it, right? Now, for the record, this is from the Georgia Educational Equity something or other. I can't remember the last word in the name of the organization. This is their attempt at equity and equality and making the case for it, okay? When we look at this image, this is what we see. We see prejudice and we see implicit bias, right? And I'm thinking because they're an educational equity organization, it was not their intent. That's the part in particular about implicit bias that's really important. Now, prejudice in and of itself is not a horrible thing. It keeps us safe as human beings when we are in situations that might be unsafe. The question is, what are you doing with your prejudice? So, this is how we look at it. Prejudice plus the use or misuse of power in systems and institutions equals oppression. So if you take a characteristic, say race, you misuse power with it, that's when you get racism. You take a characteristic, sex, you misuse power in systems and institutions, you get sexism. Why is this important? These isms intersect and interplay in our society to create what we talk about as the determinants of health. These are the things that feed into the root causes of health inequities. So to understand how and why they happen is critically important. And then to understand how to stop them also is critically important. So part of the work that we've done around the country with regard to EDI is to work with different entities. The state of Texas brought us in to create a curriculum for them focused on equity, diversity, and inclusion. Texas received the largest community transformation grant in the country, $50 million. They had 18 sub-grantee organizations throughout the state that were in rural, border, and frontier communities. Our job was to create a curriculum that went in and spoke to them, so that they could then apply an equity lens to what were called their CTIPs, their Community Transformation Implementation Plans. These plans were already in existence. They had set goals around things like cutting smoking rates and cutting obesity. But the way that they had set those goals did not have equity in mind. So by taking them through the training and actually sitting with them with their CTIPs, laying an equity lens over their plans and their goals and the data, they were able to change their goals in such a way that they focused on equity. So this is one example of how EDI can play out in a public health setting or situation. Another is EDI in business, and this has been a really interesting experience. We have been working with a Fortune 150 company as their advisors for global health and well-being. This company has an incredible reputation with regard to diversity, but they recognized that it was time for them to take it a step further. I think the reality is from the business sector that the Affordable Care Act is encouraging employers to begin to look at health more as a production and having it to go beyond wellness programs where slap a pedometer on, stop smoking, get more sleep, and for goodness sakes, don't be fat, and everything will be fine, right? Employers are now seeing that the 8 hours a day that they are investing in their employees' health is not quite as important as the 16 hours that those employees are spending in their community. So what does that mean for how business then addresses health beyond providing health care and wellness programs? So these are some of the ways that businesses are starting to look at health in terms of the column that shows you the future. So one of the big ones that I would say, and I'm going to look at the last two, is before employee rewards were seen only as compensation and benefits. So healthcare would have been included in there, right? But now they're looking at it as compensation plus benefits plus health. You have companies saying that if you work here and in this community, you will be healthier than if you didn't. If you become a part of the population that surrounds this place, when you join us, you will be healthier than if you didn't. They're actually beginning to use it as a recruitment tool. So as a result, instead of just saying, okay, we want to have healthy food in the cafeteria, they're taking it a step further. They actually had us to do a food environment assessment for Bartholomew County in Indiana. They wanted to begin to understand if their employees were being encouraged to eat in a way that was healthy, did they have access to what they needed to do that? This is an example of how business can play an important role in population health when they are using an equity lens, right? So we've worked with a lot of different entities around the country. And you know, you can talk about the equity lens as though it's this singular unified thing. I don't believe that it is. So here's what we found. Yes, you can ask this fundamental question, who experiences the benefit and who experiences the burden? But then the rest of the conversation changes based on your audience and based on where you are. You've got to make a value proposition in certain places, okay? You've got to make a moral argument in other places, right? You've got to be able to connect it to existing work and existing efforts in other places in order to get entities to make the type of investment that you would see at Cuyahoga County. There are not a lot of leaders that are willing to do what Terry has done, which is to say that this now becomes not just who we are, it becomes what we are. It is about how we do what we do in the world, and made the investments necessary for that to become true. So how do you develop leaders to do this? How do you develop leaders for EDI? The way that we look at it is through head and heart, and these three components. You build competencies for equity, diversity, and inclusion. You provide content with regard to things like historical context, and you deal with inner world, which is about people's mental furniture that has to get moved out of the way in order to create space for this thing that we talk about as equity. So the last thing that I'll say is this. Institutionalizing EDI work is a critical component of seeing any real change that's sustainable in our society, in our organizations, and even with regard to population health. To institutionalize it, it's not just about prospective transformation of individuals or organizations. It has to become a part of policy, program, and practice. And what I'll say about policy is only as good as implementation. So there are things that organizations and entities can do around orientation, around recruitment, and create the expectations for equity, diversity, and inclusion in their work. Because every workplace, every community that is more equitable will lead to more equitable health outcomes. So with that, I'm going to stop there. Thank you.
Thank you, Natalie, and thank you for your work in Greater Cleveland and helping to really help with our perspective transformation process, and it is life-changing. And so I thank you for that and your passion. I want to open with a question, and we will have time for questions. So when you approach a community, how much, or perhaps it's a blend, but how much of it is you as and your staff in terms of the training standpoint, reading the group in real time, and also the work in advance and understanding from the people on the ground in the different sectors that you speak to, understanding where they believe they are in this process of perspective transformation? Is it one or the other, or both?
So it's both, but I will say this: we approach our work and we use this phrase about respectful entry and successful exit. Respectful entry requires that you do the work that we talk about as environmental scanning. And whether you're entering a community, or you're entering a company, or you're entering an organization, you absolutely have to understand things around the issues of readiness, politics, and power. And you can't necessarily rely solely on your gatekeepers and the people who are supposed to guide you through those environments. You have to do your own looking and your own understanding. So there isn't a place that we go to do EDI work that we have not researched the historical context, that we don't understand the demographics and the shifts and the politics. The reason for that is there is the potential to do harm. You can't open this conversation, you can't begin to do this work if you don't do the work in advance, because you actually can open up things in an organization, in a community, and leave things worse than they were than when you got there. So we make the investment on the front end to do the research, understand as much as we can, and then as we roll out the process, adjust. Because you can't possibly account for every single thing that will come up. The example that I'll give is that we were in Azle, Texas doing the training, and this is a place that's 99.2% white. And we kept asking ourselves the question, how do you have the conversation about equity, diversity, and inclusion in a population and in a community that is so homogenous? Well, the woman who was there, and I got a lot of body language like this and eye rolling from her, and eventually I called her out and I said, you know, what is it? What's going on with you? And she said, there were people who came here from the state and told me that I'm a racist. And I said, well, what do you mean? What are you talking about? And she said that there was some form of anti-racism training that was done there. And a trainer actually told her that she was racist because they were having a conversation about welfare. And the participant said what she thought about welfare. Well, here's the thing. She went on to tell me she had never met anyone other than white people who were on welfare. The only bad children she knew were white children. The only people who had been incarcerated that she knew were white people. The only people who used drugs in their community were white people. Her frame of reference and her context, and as she said, I was born in Azle, I was educated in Azle, and I'm gonna die in Azle, okay? And it was very clear from her conversation, and plus she told me that Christ calls on her to love everybody, so no, she's not a racist, okay? And I appreciated her candor because obviously that was a very hurtful experience for her. And what it told me was that the people who'd gone to have this conversation with them, they didn't do their homework. They had their implicit bias in place. And they're the trainers. They're the people who are supposed to be coming to help folks to have this conversation in a way that's healthy and safe, and they didn't do that.
Pamela Russo from Robert Wood Johnson Foundation and the Roundtable. We spoke at RWJF as well, I think, recently. My question is, the Ford Foundation has this huge new campaign, Inequality Is, right? And people are responding on Twitter and responding in other ways. And you made a very careful distinction about language. So I was curious what you thought.
I think it's a problem. And so this is part of the larger conversation, and what I would say is the need for the development of a comprehensive narrative about equity. And if we are supposed to be in the lead, if we are supposed to be leading this work, it's our responsibility to pull Ford's coattail and say, hey, this is good, but, and then help them to begin to figure out how to course correct, how to recalibrate, because quite frankly, to put people into a space of talking about equality at this time is actually, it has the potential to do harm. And to actually, weaken some of the conversations and the cases that people in this room might make for the types of work that we do. Thank you.
Natalie, thank you for the wonderful presentation. You mentioned early on, and I think you alluded to a little bit in the presentation, about readiness. And I wanted to just get your sense of, what does that mean for not only individuals, but in organizations and systems? How do you know that they're ready?
So there are a number of different components, and thank you for that. Readiness often has to do with leadership, and leadership, sometimes as individuals, they're not ready, but they recognize that something needs to be done. The reality is, when you open the door of equity, diversity, and inclusion in an organization, you have to be ready and willing to assume a certain amount of risk. The risk to be introspective. So usually we suggest that organizations do a level of assessment, whether that's surveying or focus groups or key informant interviews, et cetera, and to see the truth of who they are. So they have to be able to assume the risk of seeing that truth. That's a very important part of readiness. The other is there are conditions that individuals and organizations will demonstrate with regard to change. And one of the things that we found is a lot of times organizations will embark on this journey and not recognize that this is evolution, it's not revolution. So part of what we have to do is to create realistic expectations about the speed with which change will happen as it relates to EDI and perspective transformation. Help them to understand that this is not something you pull off the shelf and it's ready to go, but rather it is a journey. It never stops. Equity is not a destination. You don't get there and say it's Thursday the 23rd, check, and you're on to the next thing. It doesn't work that way. So I think they have to be ready for the journey. And being ready for the journey is about resources. It's about support. Let me go back to resources. A lot of times organizations will want to say, we want to do the training. Okay, then what? There's stuff that you need to do around, we talk about it as the 5 M's, right? So you've got to map it, you've got to make it, you've got to manage it, you've got to measure it, and then you have to master it. That takes like a lot of effort, and it takes a fair amount of resources. So one of the things to do in advance to ensure that there's really readiness is to begin to understand the resources available in terms of human beings and in terms of actual dollars, creating this realistic timeline. And if the organization and the entity is willing to accept the long-term timeline, that is usually a good indicator of readiness. The other is moving stuff out of the way. If you go into certain organizations or communities and try to have the conversation of equity, diversity, inclusion, racism, privilege, oppression, you have to be ready to deal with the wounds, the traumas, and the assaults of what have happened before you've gotten there. And that's even within an organization. Because you cannot layer this stuff around EDI on top of people's tragedy and their pain and their heartache that has never been acknowledged or dealt with, right? So part of creating readiness is creating spaces for people to tell the truth and then helping them to move on from that truth. Jermaine?
Hi, thanks so much for being with us today. I'm Paula Lance. I'm a member of the Roundtable, and I'm also from the University of Michigan, which is in a town called Ann Arbor, which is 40 minutes down the road, Highway 23 from Flint, Michigan. You know, as the layers of this become, you know, the onion become unpeeled more, and we understand more and more sort of what has happened over a long period of time in this community, and then the sad fact that Flint is not the only community that is having issues with water quality and lead. I'm just wondering, from your perspective, can you, you know, what is so wrong? You know, what is going on? Is this a problem? There's no head and no heart. You know, how do we, in the year, you know, 2016, are dealing still with such unconscionable tragedies?
One of the things that keeps coming up in my conversations, I would say in the past few weeks in particular, is about the cycle of low expectations. There are communities around this country that their leaders don't expect any better for them, and they don't necessarily expect any better for themselves. And part of that is because we have not dealt with the wounds, their traumas, and their assaults. I think in addition to that, there are lots of people, populations of people who have internalized the isms. They carry that with them. And when you carry that burden, it becomes very hard for you to hold leaders and systems accountable. I would say that communities that are under-resourced like Flint, people are walking with a level of chronic stress that doesn't allow for the space for advocacy that you can see in other communities, and people might judge them for that, but survival can be really tough, right? So I think that in order for us to begin to ensure that we don't see Flints in the future, we have to make the investments in creating higher expectations. We were looking at a well-being index of some sort the other day, and one of the questions that they asked people basically was about, are you living like your best possible life? And if they said yes, then it was like, yeah, they got a high score. Well, guess what? In some communities where we go, there are young people who will say, yeah, my life is great. I lived until I was 28. Is that good enough? It's not. So we have to create different expectations, partly through doing this work around equity, diversity, and inclusion, partly to give communities a language so that they are able to advocate on their own behalf, so that communities, when they're making the case, they're not just making the moral argument, they're not just making the heart case, but they're able to make the head case and the heart case, right? And we have to begin to hold leaders accountable in some new and different ways. And we also have to train a new generation of leaders that have equity, diversity, and inclusion woven into who they are, so that their mental furniture is set up in a way that's very feng shui.
We can take these two final questions.
Jermaine.
Hi, Natalie.
Hi.
How are you? Thank you so much for your talk. It's always great hearing you talk. It seems to me that there are two groups that could benefit from this kind of training. And I wondered, had you thought about it, or have you given talks to elementary students, school students, and then policymakers? It seems that might be one approach, given that we've got a lot of, I think, confusion and turbulence around the country right now. Dr. Gee mentioned Black Lives Matter. It seems that the larger community in the U.S. doesn't really understand what the Black Lives Matter movement is about. And there's confusion, I think, about equity and equality, and I'm not quite sure that it will change unless we start to have these kinds of conversations with little children of all ethnicities. So I just wondered if you thought about it or have done talks to young children.
So we've done both. And what I would say is with, I'll say youth, to use a broader brush, I find that they are more open and they're easier to access because their mental furniture hasn't gotten nailed to the floor yet, right? Elected officials, the experience with them has been incredibly challenging. They have the heaviest furniture, right? And so we need to like call in reinforcements and a dolly to try to move stuff around for them. And unfortunately, when we're brought in to do that, it's usually not for the deep dive. And I think they need the deepest dive. So, you know, certainly the elected official, but also their staff, their legislative assistants and so on, the people who have their ear and really help to create the context for the elected official, they're critically important as well. But whenever we've been called upon to do that, it's been a short-term engagement, and I actually believe there needs to be some sort of an EDI academy for elected officials that's like a 9-month immersion experience. And you know, inclusive of like a 2-week retreat where they can't leave and use a phone type of thing, in order for us to really see the type of change, because some of what they are carrying is very ingrained with regard to systems, policies, process, and power. So I think we would have to do a very intensive piece of work with them.
Hi, my name is Natasha Clavel, and I work for NRC at the University of Chicago. How can we start the journey towards perspective transformation for people who just don't think that they're part of the problem? For example, there's literature that concludes that healthcare providers, doctors, nurses don't think that they ever treat their patients differently based on sexual orientation or race. How can we start that? It can't just be leadership or training. I mean, even if they start a training, even if there's a space of inclusion, if you don't think you're racist, if you don't know of your implicit bias, how can we start that?
So there are ways to do assessment of implicit bias and those types of things, but I think what we have found, and it was a bit of an aha moment for us, was really around privilege and oppression. The conversation about privilege and oppression creates a space that didn't exist before when we spoke about racism. Because when we would talk about racism, people would take it as a character assessment, a judgment of them in a way that they then became inaccessible. And inevitably, we would have people who would say, I have black friends, right? And I'm a good person, okay? And no one is saying that you didn't have black friends or you're not a good person, right? But that was the space into which they went. When you begin to look at issues of privilege and oppression, and you begin to see the many ways that that plays out in society and the intersectionality associated with that, people then can begin to understand the journey and the challenges that other people face. And so it's interesting because in the training we talk about, in our society, it literally costs more for a woman to buy deodorant, razors, to get a shirt cleaned at the dry cleaners. Our jeans cost more. Production on those things doesn't cost more, but they're actually taxed at a higher rate when they come into the country, and we pay for that when we go into the store. So in an overall analysis, you would say, you know, it's a little easier to be a man in this society than it is to be a woman. But then if you layer race onto that, what does that mean? Is it a little easier to be a black woman or to be a black man, right? If you were to think about what does it mean to be Muslim in society, what does it mean to be Muslim in Detroit, in Michigan, versus being Muslim in Little Rock or somewhere in Texas, right? So I think when you start to talk about intersectionality in that way, and people begin to identify their own privilege and their own oppression, and recognize that we all carry it to varying degrees, they can then begin to relate to the struggles of other people. That's why this issue around age, becoming an elder, and age discrimination is a space where you can actually begin to have a conversation. Because if the person is not of that age now, they probably have parents who are, or grandparents, and they see the challenges that they face in accessing systems and institutions and how society deals with them. When they can connect on a personal level to someone else's oppression, even if they don't experience the oppression themselves, it opens them up to have the larger conversation. So for us, privilege and oppression is a space where we can begin to talk about it.
Thank you.
You're welcome. Okay.
Thanks very much for your talk. I'm Martha Gold, a member of the Roundtable. You mentioned competencies, and I know that's probably a very large topic, but it gets at the issue of measurement, and I wondered if you could give us just a little bit of a sense of what you look for over a period of time in terms of competencies in an organization that's trying to change.
So some of the things that we do in terms of collecting the baseline information on the types of competencies we have. So we actually have individual competencies and we have organizational competencies. And then within that, we layer over levels of action that are taken over time. And that's how we really assess where an individual is or where an organization is. One of the most important things that we do in going into an organization is to look at their policies. So to literally go through, look at policies, look at their strategic plan, and actually lay an equity lens over those things and do the work necessary to adjust them and recalibrate them so that they can be accurate. So I think the key is, and I go back to perspective transformation, it's to know, think, and believe something different so you decide, act, and do differently. The entire competencies framework that we've built out is very focused on how do you move from that first part to the second part, which is about taking action on an ongoing basis, which is about how do you engage in continuous learning, how do organizations set up structures, how do they create incentives and expectations about the application of the learning in their environment through policy, program, and practice. That's it. Thanks, Terry. Thank you. Appreciate it. Thank you.
We're going to take a break now. For a few minutes, I think perhaps 10 minutes or so. And coming back, Lourdes Rodriguez will take us to the next segment of the workshop. Thanks.